Hi, everybody. I am syncing up all the channels, so just give me a minute to get started here. Instagram, always the latest, the last one to go live. Anyway, we'll do our best. So hi, I'm Dr. Gina, and this is day 2 of 100 days of fertility. So excited. And I apologize because yesterday was supposed to be day 2. Today's Sunday, but we got like a foot and a half. I'm putting outside, but you cannot see. We got like a foot and a half of snow at our house. So our Wi-Fi wasn't having it. So I couldn't go live. So it's nice to see you, and we'll just pick up where we left off. And I wanted to just tell you a couple things really quick. Let's see. All right. So we are live for 100 days. And the best thing to do is to subscribe to whichever channel you're watching on, either TikTok, Instagram, YouTube, Facebook, wherever you are. Just subscribe, because when I go live, it'll just give you a little notification that I'm on live. And if you're seeing this in recording, that works as well. But most importantly is ask questions. Ask questions in the comments. And if you're on a channel, YouTube, you can just do comments. But if you're on TikTok, or if you're on Instagram or Facebook or one of the other channels, then you can private or DM me and ask questions if you want to keep it private. And then I will answer you and anonymously give you your answer. But I do have a question from Andrea, who was on Friday on the day 1. And she has an excellent question that I get pretty often. And her question was, what can she do to get pregnant after she's come off of Nexplanon? I always wonder if I'm saying that right, Nexplanon. So that's birth control. And anyway, so I don't need to go into that. If you're coming off of any birth control, there's a whole lot more I could say about like that specific one, but let's just say in general, there's a lot that you can do. Now, I did do a little bit of research to see like, well, how long does it normally take to regulate the cycle after getting off of Nexplanon? And some of the research, there wasn't much on it, but it went back to the 80s and 90s is where I got some of the info. There's like little bits here and there, but I'm going to tell you, let's see, first of all, yeah, it's an implant. So I'm not sure. Well, back it up. I'm not your doctor, so always check with your doctor, please, and ask. So if I had a patient come to me, or if I had a client working with me, these are some of the recommendations that I would make to them. And first of all, it's great. You got off of birth control. Some women's cycles can regulate. Usually they're told it could take a year to regulate this cycle, but I haven't seen that in my clinic with patients or working with clients. And that's because I think if people wait and they see what happens, then yeah, it could take a year. But there's so many things that women can do once they get off of birth control. So let's understand the return of fertility health after you come off. So first thing you want to do is start tracking. And be methodical about it, not random. So I would get a journal and start tracking your menstrual cycle. And if you're like, well, I don't have a menstrual cycle, that's fine. But you're going to look at all the symptoms, okay? Or just a life journal, not even like it's like a life cycle journal. So I would recommend, so when you do go see a doctor, or if you wind up working with me, or if you work with another healthcare practitioner, we appreciate seeing a journal that's tracking your moods, your sleep cycles, and like what time do you go to sleep? What time do you try to go to sleep? What time do you usually fall asleep? Do you wake up in the middle of the night? What time do you wake up in the morning? And what's your energy levels like? How's your appetite? And then you want to start tracking some food and see what time. I like to have people send me in at least a 3, and it just depends on what clients or patients are coming in for, sometimes up to a 7-day food diary. I want to know what time you're eating and everything and anything. breakfast, lunch, dinner. If you're eating snacks, I want to know the time and what you're eating. And then just to like do it normally and not judge. It's not a judgment. It's just to kind of get a gauge of where you're at and things that we might be able to improve or add in or take out, that kind of a thing. But there's so much. There's also like, how's your gut? How are your bowel movements? Do you have excessive thirst? Do you have discomfort in your digestion? Do you have an appetite? Do you have a big appetite, low appetite? We ask so many questions. So I would say start tracking, but you can start with menstrual symptoms. Sometimes women can get cramping or bloating, and they're like, oh, this feels like I'm getting a period, but I'm not sure because I'm not technically bleeding. So there's just start tracking any kind of symptoms. Hi, Andrea. If you're still on here, I'm answering your question and you'll just have to roll it back a little bit. But there's a lot that you can do. And again, so I'll just kind of go back a little bit, but a lot of people ask, what can I do once I get off of birth control? And I would start with tracking your cycle, any kind of symptoms, headaches, digestive, are you sleeping? Are you not sleeping? All of these things. Are you spotting? Do you have discharge? And go start with there. And then you want to start looking at charting foods. Are you getting a balanced diet? Do you get regular exercise? What's your weight like? And then, of course, we want to start looking at more specific things like avoiding like smoking and alcohol and limiting or totally eliminating caffeine. Again, speak with a doctor. These are things that I recommend with my patients or my clients. And then, of course, always women can start prenatal vitamins right away. As soon as you think that you're going to start to try to get pregnant, you do want to add in a good supplement. Now, that's a whole other discussion that I can bring up maybe in the next day or two, how to pick a prenatal vitamin. But you definitely want to look at something that contains folic acid. And there's so many other vitamins to get, like vitamin D's and B's, and it just really depends on the client or the patient. You want to stay hydrated. So I recommend to my patients, my clients, to drink at least half of their body weight in water in ounces. So if you weigh 150 pounds, then you would shoot for drinking 75 ounces. But of course, this will depend on your level of activity. So if you're physically active, which I hope all women are physically active no matter what stage of life you're in, that you're getting enough exercise. So I have a smartwatch now that when I exercise, it actually tells me to drink more water, which is great. Let's see what else. So you also want to look at eating close to like a Mediterranean diet. But for women that may have like PCOS or something like that, then you want to look at low glycemic index foods, low anti-inflammatory. I say for anybody who's trying to get pregnant, because nutrition plays a key role in fertility health and overall health. So we want to do this to get pregnant, but it's also really, really crucial to treat yourself to nutrition and a healthy lifestyle on a daily basis for everything, because all systems are integrated and work together with fertility health, but with everything, with mental health, physical health, emotional health. And that brings me to emotional health. It's like we also really want to look at stress reduction. So what's causing stress for us? And that's something else. I mean, you can use the journal for this. And I'm actually working on a journal because I'm always making these recommendations and people are like, I don't know what to chart. But looking at reducing stress if it seems significant. But on a daily basis, we need to work on this. It's not like once a week do yoga or once a month do this. Oh, I'm going to go get a massage once a month or something like that. Like on the daily, it's just like taking out the trash, right? We're not going to be like, okay, once a week the trash truck comes, so I'm going to just take it out on Mondays, which is our trash day. But every day you're like cleaning up the kitchen, but you're cleaning your internal self to get rid of any kind of like emotions that might be stagnating or causing some internal stress, because a lot of times our thoughts will turn into patterns for us. So it's not just these are my thoughts. All of a sudden, if it's not a correct thought, or if it's a negative thought, or I'm not feeling good about it, or I don't trust I can do this, or that I'm strong enough to do this, something like that. We have to change that thinking. And so write down these things, because there might be specific times a day that you have negative thoughts or whatever. But anyway, start charting what feels significant to you, because if you have the thoughts, then eventually we start believing our own thoughts sometimes. And if they're not healthy thoughts for us, they could turn into actions. And then we start believing everything and we start acting a certain way. So it's really important to reel in the thoughts and to get rid of stress before it settles into the system, into the body. And I love talking about the menstrual cycle because so much shows up in there. And that's a whole other discussion as well. Yes, so we will get to that, but not today because I'm doing just a quick, because I'm dressed up. We got a foot and a half of snow yesterday, and I will be sledding in about 5 minutes with my son. Okay, so the other thing is you can schedule a preconception checkup with a doctor, or like I work with women all the time on preconception care, just to get them going to meet women where they're at and see which maybe 1 to 3 areas to focus on depending on what's going on. It's not like you get this one plan and everybody gets the same plan because we're all different humans. Okay, and then just understand that it can take a couple of months or longer, just depends on the woman and what the medical history is attached, um, just to regulate the cycle and to start regularly ovulating. And then once that happens, it still can take some time, a few months or so, to conceive. And so if it is taking longer than that, then that's something else that I would focus on with a client or a patient. And then again, like you do want to monitor any kind of like health signs that come up that you're not used to or something that's new, and then learn signs of fertility health. And so that's something else I will be doing. I'm doing the 100 days. And by the way, if you're just popping in, then make sure that you subscribe to my channel so you'll get a notification when I go live. But for 100 days, I'm going to talk about everything that we can do to help you to improve egg quality, to help prepare for IVF cycle, to improve natural fertility health. Where I'm coming from is integration is best if needed, or if there's been a delay with fertility health. It's good to get some labs and that kind of thing done, but I will get more into those details. But going back to fertility signs, like looking at mucus color, but again, like basal body temperature, start tracking all of these things. When you do have a regular cycle, or when you do start to have a cycle, it's good to look at color, quantity of blood. Are there clots? Is it painful? Do you have pain in your stomach, in your neck, in your back? Do you have digestive disturbances? All of these things are factored in. And it's literally like a monthly report card that we can look at and say, oh, okay, I'm going to need to do XYZ because I've got this going on, or I'm having irregular cycles. So this is me wrapping it up on day 2. We had a snowstorm yesterday, so I wasn't able to get on Wi-Fi, but I'm back. And yeah, day 2 of 100. And let's see, tomorrow, I think what I'll look at is I have a whole list of things, but since I mentioned a few things, let's look at maybe how to pick out a prenatal. But also I'm going to look up for follow-up questions, and I get them in my DMs often as well. And I like to work that in because that's the information that you're looking for. So don't forget to subscribe. And then I also will put a link in there, or message me and ask me for the link to join. I offer a weekly live, a free Q&A with me in Zoom. It's private, which is nice because if you don't want to talk about your fertility health in public on social media, I totally get that. So if you're interested in joining me this week or in one of the upcoming weeks, then drop a note and I will send you the private link there. Thank you so much. I am heading off to go sledding with my son. Have a great rest of your Sunday if you're watching this today. I'm Dr. Gina. Thanks for watching.